You know, it's pretty incredible to think that one single medication can stop a seizure, calm the intense highs of bipolar disorder, and prevent those awful migraines. That's valproic acid for you. But, and this is a big but, with that kind of power comes some pretty serious risks. So in this guide, we're going to navigate that delicate balance so you can understand how to use it safely and effectively.
Okay, so here's our game plan. First, we'll cover the basics, what valproic acid even is. Then we'll look at its three main uses. After that, we are going to dig deep into the serious side effects. Then, we'll run through a super practical safety checklist and finish up by identifying who really needs to be extra careful with this medication.
All right, first things first. What exactly is valproic acid? Let's get down to the fundamentals. So at its heart, it's a prescription drug that works on your central nervous system. Think of it as a way to kind of turn down the volume on the extra electrical activity in the brain. And it's this unique ability that makes it such a versatile tool for three really different and often really challenging conditions.
And that versatility is what makes it so amazing, really. So let's look at why it's known as a triple threat treatment. That's right, the number is 3. It tackles 3 totally distinct conditions. And get this, these aren't just some off-label uses. These are all fully FDA approved.
And here they are. For folks with epilepsy, it's a powerhouse anticonvulsant that can manage all sorts of seizure types. For people dealing with bipolar disorder, it acts as a mood stabilizer to get those manic episodes under control. And finally, if you're someone who suffers from recurring migraines, it can actually work to prevent the headaches from ever starting. Pretty incredible.
Okay, we've got to talk about this next part, and it's probably the most important section in this whole guide. A medication this effective, well, it doesn't come without risks. And understanding what they are is absolutely critical.
And it kind of makes sense, right? The same power that helps calm your brain can also have ripple effects on other parts of your body. That's why being able to spot the warning signs is your absolute best line of defense. Let's start with the more common things you might notice. An upset stomach, nausea, indigestion, that's pretty frequent. A great tip is to always take it with food. That can really help. Also, you've got to keep an eye on your skin. Any new rash, or if you feel like you're bruising way more easily, tell your doctor right away. That can be a sign it's affecting your blood platelets.
All right, listen up. These are the red flags. These are not wait-and-see symptoms. If you have severe pain in your abdomen, especially with nausea, that could signal pancreatitis. If you're feeling really confused, out of it, or super sleepy and you're vomiting, that could mean ammonia is building up in your blood. And this one is huge. If your skin or eyes start to look yellow, that points to liver damage, which can be fatal. If you experience any of these, you need to get medical help immediately.
And this is a critical warning for anyone who could become pregnant. Valproic acid is what's known as teratogenic. It's a medical term that means it can cause serious birth defects, especially to a baby's developing brain and spine. It is absolutely essential to talk about your pregnancy plans with your doctor before you even start this medication.
So knowing the risks is half the battle. But it's not just about being aware. It's about being prepared. Let's talk about the practical steps you and your healthcare team can take to make sure you're using this medication as safely as you possibly can.
And this really is the core idea, right here. You are not in this alone. Using this medicine safely and effectively is all about teamwork, a partnership between you and your doctor, built on good communication and just paying attention.
So what's your medical team's side of the deal? Well, they should be monitoring you with regular blood work to keep an eye on your liver, your platelets, and your ammonia levels. They'll also check you for any of those physical warning signs. And a good provider will always aim to keep you on the lowest dose that still gets the job done. And if pregnancy is a possibility, they'll be talking to you about folic acid to help reduce some of the risks.
Okay, now for your part. And this is where you have so much power because nobody knows your body better than you. Simple stuff like taking it with food can help a lot, but your most critical job is to be the early warning system. You're the one who's going to notice that weird bruise, or feel that pain, or know that you're just not thinking clearly. Reporting these things immediately is the most important role you play in your own safety.
So as good as this medication can be, it is definitely not the right choice for everybody. Let's break down which groups should probably avoid it completely and who needs to use it with a whole lot of extra care.
This lays it out perfectly. On the left, you see contraindications. Think of this as the do not take list. That means anyone pregnant or breastfeeding, anyone with liver issues, or anyone with what's called thrombocytopenia. And that's just a fancy word for very low blood platelets. Then on the right, you have precautions. This is the use with care list. So folks with kidney disease, older adults, and very young children under 2, they might still be able to take it, but they need much, much closer monitoring because the risks are just higher.
And remember, medications don't exist in a vacuum. They can interact with each other. For example, if you take valproic acid with other seizure meds like phenytoin or phenobarbital, it can actually cause their levels to spike in your blood. And if you combine it with topiramate, you have an increased risk for that high ammonia level we were talking about earlier. It's so important your doctor knows every single thing you're taking.
So, after all this, we come right back to where we started. Valproic acid is a truly powerful tool. It offers life-changing benefits for so many people. But that benefit is always in this delicate balance with some very serious, very real risks that have to be respected and managed carefully.
And that brings us to the final thought. This guide is here to arm you with information, but the most important conversation is always going to be the one you have with your doctor. So I'll leave you with this. Now that you understand this balance of benefit and risk, what is the single most important question you should ask your doctor to feel confident and safe with your treatment plan?